Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. This is Black Maternal Health Week, and tonight on this Wellness Wednesday, we shine a spotlight on the stark disparities in maternal and infant health outcomes that impact Black women and their families. Statistics tell a sobering story. Black women are 3 times to 4 times more likely to die from pregnancy-related causes than their white counterparts. So what's driving the numbers in the wrong direction for Black mothers, and what's being done to address the problem? Well, joining me to talk about this are Dr. Darrell Gray II, CEO and President of WellPoint, Maryland, and Jasmine Seville, Whole Health and Equity Director for AmeriGroup DC. Thank you both for joining the conversation.
Thank you so much for having us, Harold.
Sure thing. Let me share a few fast facts before we get into this conversation. There have been several studies that have concluded that Black women often experience delayed or fewer prenatal care visits. Systemic racism and implicit bias in healthcare often lead to Black women receiving lower quality care and having their health concerns disregarded or minimized. And certainly factors such as socioeconomic status, living conditions, and stress from racial discrimination play a significant role in maternal health disparities affecting Black women. I want to first give people an understanding of what Black Maternal Health Week is and what are the goals. Ms. Seville, I'll let you start that conversation.
Sure. Black Maternal Health Week takes place April 11th through April 17th every year. It was started by the Black Mamas Matter Alliance to just really put a lens on the state of Black maternal health care. The statistics remain alarming. In the district, almost 30 deaths or maternal mortalities for every 100,000 live births. But unfortunately, the majority of those are happening with our Black and brown moms here in the district. So really taking the time to look at what's going on, what is the data telling us, how do we create community-based solutions, and really make sure that we are improving access to care and making sure that it's like culturally attuned as well. So that's where we are right now. It really aligns with what we're trying to do at AmeriGroup DC, and just, happy to be participating in the conversation.
Mm-hmm. Dr. Gray?
Well, first, Harold, I want to kind of talk to you and Jasmine and your listeners around the perspective that I kind of come to this week with. So not only, as you introduced, do I get to serve as the president and CEO of WellPoint, Maryland, one of the largest Medicaid managed care organizations in the state of Maryland, serving over 270,000 people across the state, including largely moms and children. But I also am a husband of close to 15 years to a beautiful and brilliant Black woman. And we have 4 children together. And so we certainly have our personal experiences with navigating the healthcare and particularly maternal health journey with our children, but certainly with us getting to lead and serve 270,000+ members across the state. We get to see firsthand through our capacity at WellPoint the opportunity and the advantage that we have in helping to care for Black moms. And particularly during this week, as Jasmine so eloquently highlighted, we get to first acknowledge the data that you just highlighted, Harold, and the opportunity that we have to reverse course, to have a significant impact on the health of mothers across the state, and certainly what we need to do immediately in improving maternal health for all moms.
So, which brings me to some really, I think, important questions regarding, social determinants of health and maternal mortality rates, among Black women. How would you characterize them, Ms. Seville, right now for the communities that you are most familiar with?
We hear the term social determinants of health. It's definitely at the forefront of most health-related conversations, understanding that like health outcomes are much more complex in nature. It's more than just doctor's visits, but it's also those health-related social needs, access to transportation, access to fresh and whole foods, and things of that nature. I would say right now, especially here in the district, what you'll probably see nationwide, is just when you lack access to care and resources, that's where your disparities take root. That's where those inequities take root. So there's a lot of place-based disparities. Here in Washington, D.C., we've had a maternal desert in some of our most vulnerable areas of the city, particular Ward 7 and 8, where they closed the maternity ward at United Medical Center back in 2017. Gratefully, we just had the ribbon cutting ceremony opening up Cedar Hill Regional Medical Center just last week. And so now that will bring back comprehensive, full-scale OB maternity care in Washington, D.C. in Ward 7 and 8. So just that lack of access, I think, creates a lot of issues. If someone doesn't have the bandwidth to be able to commute from Southeast Washington, D.C., to Northwest Washington, D.C., to get regular care, emergent care, urgent care, that creates issues that are wholly avoidable with the right things put in place. So, making sure that people have good access to care, that it's culturally sensitive, and that they understand that they are entitled to having a really safe and just fantastic birth experience is, one of the major things that we have to drive home.
Well, but let us look, I think, at the whole of the DMV. As we know, not all Black women live in underserved communities. Not all Black women are poor. Suffice it to say that the DMV probably has the largest percentage of educated, affluent Black women, more than any other part of the United States. So with that said, why do you suppose that this remains an issue for Black women who have access to transportation, have access to good health care, have access to healthy foods, and all of the other things that may contribute to this issue?
I think that, you state a really good point. It doesn't matter for socioeconomic status when it comes to Black women. A lot of times their experiences and outcomes can look similar despite the number of buffers that they're able to introduce for all the reasons that you noted. I think it has to do with just not feeling seen in your care. I think that there is systemic issues that allow implicit bias to take root in the way that we receive our care, the way that it's approached from the provider side. And I think that can have impacts in outcomes. You stated earlier that a lot of times people feel like their care is potentially delayed, as if they're not being heard when they say they're in pain, that something's wrong, really not regarding and acknowledging our own knowledge about our bodies and experiences. Listen, I'm married, I'm a mom. I've had my own experiences with birthing where I'm saying, I know what's happening, something is amiss, and not feeling heard, but having to really know how to advocate repeatedly and say the same thing until I feel seen and heard to be able to get the care that I most need. But a lot of times people don't always have someone to stand in that breach or necessarily educate them on how to navigate that space. And that's where you're starting to see those outcomes, regardless of socioeconomic status.
Dr. Gray, the same question.
Yeah.
I think that, you're a Harvard educated Black man. Okay, like you said, a father 4 times over. You've not yet spoken about the experiences that you and your wife have had And before this conversation is over, yes, I'm going to get into your business. So I promise you that I will, because it is important. It's one thing when there are circumstances that are absolutely positively keeping, those mothers or those mothers to be, those expected mothers down. But I think it is important to understand that if these same kinds of things are happening when the playing field is for the most part level, I think that's the thing that people really want to be able to understand. It's one thing if you don't have a car. It's one thing if you don't have access. But when you talk about healthcare throughout the process, and we're going to talk also about postpartum issues as well. But from your perspective, I would imagine all 4 births were not the same.
That's correct. And I'll tell you, Jasmine painted such a vivid picture of the current state. What I'll add is you mentioned my background at Harvard. One thing, there's a quote that was said numerous times while I was there, and it rang true. And that is, every system is perfectly designed to get the results that it gets. And so none of us should be surprised at some of the data, like what you presented, some of the inequities that we've seen, because our system has been designed to foster those outcomes. Now, the good news is that many of us, Jasmine, myself, many others, are part of trying to be part of the solution to really redesign how we operate and how we work with mothers and many others in our healthcare system to navigate this maternal health journey to improve outcomes. Jasmine spoke to the fact that, there are barriers outside of just what happens in the ER, outside of what happens in a clinic or in the hospital, that impact a mom's outcome, that impacts her baby's outcome. Those things can be factors that are in our communities, factors that are in our homes, factors that are what we call, as you said, social determinants of health that influence her care and her outcome, regardless of, like what you said, socioeconomic status. Because we know, particularly as you mentioned, Harold, for Black women, wealth may not be protective for maternal health outcomes. And so there are other factors that are at play that we have to assist in navigating. And Jasmine said so nicely that one key area that we can continue to improve in is how we listen to moms, how we listen to those around here, those caregivers, those who are involved in the family, and how we leverage what we hear to then co-design interventions that are tailored to that mom's situation. And so I think, the olden days of a one-size-fits-all approach to medicine and healthcare, that cannot be if we want to see improvements in maternal health. And I think as we've seen over the years and more recently, whether it's how we integrate doulas into the healthcare journey, how we integrate community health workers into the healthcare journey, how we are diversifying our healthcare workforce, how we're introducing training for our healthcare providers. All of these things matter if we hope to get to better health outcomes. And I think Jasmine spoke to it so nicely. And that's part of what we're doing through WellPoint, Maryland. As we, in 2024, we had over 6,000 births. As I mentioned, we have 270,000 members. We have thousands upon thousands of births each year. And every year, we're trying to ensure that our maternal health outcomes improve year over year. But it takes staying on the cutting edge of what our moms are saying.
Yeah, I think you make a really excellent point. And to that, we are going to take a considerably deeper dive into all of those issues in just a bit, but I do have to take a break. So please stay with us. Don't forget, you can hear this and every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is next on WHUR. I'm Harold Fisher. This conversation continues on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our conversation about Black Maternal Health Week. My guests are Jasmine Seville. She is the Equity Director and Whole Health Director for AmeriGroup DC, as well as Dr. Darrell Gray, the second CEO and President of WellPoint, Maryland. Before the break, one of the things that we were, talking about is kind of educating the whole community and getting them to understand some of the issues that impact Black maternal health. If you can, Ms. Seville, talk a little bit more about first of all, educating the mothers and what they need to know as it relates to prenatal health, but also what the people around those mothers need to know specifically.
No, that's a really great question. So I feel like education is always so important. A lot of times I feel moms have not really engaged healthcare as in such a robust fashion as they do when they're pregnant. And at this time, not only are they pregnant considering the care for themselves, but also the next life that they'll give birth to. So early care, early prenatal care is super important, balanced nutrition, but also making sure that you're checking in with your mental health and your mental wellness, your emotional well-being. And then the conversations around them need to be, how do we support and make sure that we're taking an integrated approach to creating a network around this mom, making sure that they maintain their clinical appointments, but also that community resource piece, whether that is just practical support from family members, village members, but also making sure that they have just that reassurance that, having a good outcome is possible. I feel like a lot of times there can be delays because pregnancy isn't always planned, right? Sometimes people find out that they are expecting and it's kind of like, I was in a car accident, went to the ER, had a urine test, and now I'm finding out I'm pregnant. And sometimes we can wait making decisions around whether or not they will keep their pregnancy until they give birth, not seeking care. And I still feel like that is a super duper critical time to figure out how we are going to engage our providers and stay in relationship with them so that we can address any concerns early on, all the way through your delivery as well as your postpartum care, making sure that that comprehensive support stays in place so we can continue, good care, good access, maternal health screenings, and that you don't feel like once you've delivered that the focus is no longer on you and only on your infant, that your care is taking a back seat, and that's not the case. So just making sure that they continue to feel seen at every stage of the reproductive life cycle is super important.
How do you
think
information?
Can I
Yeah, no, please go ahead. Yes.
Jasmine, one thing that you said that was buried in your comments that I really just want to emphasize for the listeners is that healthy pregnancy starts way before the pregnancy. A healthy mom starts before she becomes a mom. And it starts with, to your point, ensuring that you have established care with a healthcare provider, a healthcare team who knows you, who you have a relationship with, who you trust, who you can talk to, who will listen to you, who will be there when you have a concern. And because that increases the chances that when you do become pregnant, if you become pregnant, that you'll have a healthy pregnancy, a healthy delivery, a healthy postpartum period, and a healthy baby. And so that journey starts before even conception. And so ensuring that you have established care with a primary care provider or team or care team is incredibly important. So getting plugged in even before you decide or become pregnant.
Mm-hmm. You want to unmute yourself, Ms. Seville?
I was just echoing sentiments of that was an excellent point. Preconception health.
Yeah, well, important. Echoing, we should hear echoed sentiments as well. One of the other things that did occur to me was when you're talking about educating the mothers greater community, those people who are not just in the inner orbit, but in the outer orbit. How do you think, as it relates to Black maternal health, the information and the messaging has changed when you compare 2025 to, say, 1995?
It's so different. It's so different. I feel like that it's such a loaded question. I feel like it's so different. I feel like there is so much more access to information through technology. I feel like there's access to information that at times, if you're not well versed on how to decipher which information is true, which information is accurate, it can be overwhelming, it can be confusing. A lot of times our attention spans, I feel like technology has kind of shortened them. So sometimes people get their information in really small bite size, and they're connected more to their community virtually than they are sometimes their community in person. And I feel like really with the increased access to doula care, we are kind of returning back to our roots in a way that is really supportive. We're returning back to including our village in our early care and our, that sitting month after you deliver and getting that support and understanding that this isn't necessarily a foreign concept, but one that's actually quite traditional and is proven to have really great outcomes. And I think that information is best received in close-knit relationship. It just I don't feel like it always lands quite as well when it's coming from medical professionals who are, experts in their own right. But sometimes I feel like there can be a dynamic that creates a barrier where people don't always fully trust the information that they're receiving. They would prefer to go with the information that they get from, someone that they trust, someone that they know virtually, or someone that's in their community that they access on a regular basis. And that can be a little problematic. So making sure people understand how to consume information and rightly divide what's accurate from what's not accurate or just sensational is super important.
Mm-hmm. Dr. Gray, I know you have some thoughts about that.
Absolutely. I think Jasmine hit the nail on the head. I'd say that a change from the 1990s till now is there's greater emphasis on health literacy. I mean, the fact, Harold, that you're having this conversation, this much needed conversation right now in plain speak without all the medical jargon, right? I'm a physician by training, but it's incredibly important, like Jasmine said, to have plain speak that people can understand, is approachable, that hits them where they are, and something that in a way that they can relate to is incredibly important. And I think that's been part of the big change since the 90s. I think also representation. As we think about whether it's tech platforms or you're going into a doctor's office or you're out in the community, you're seeing more images that look like you as a mom or as a supporter, a healthcare supporter, or a member of the family. You see yourself represented more so in the images that are portrayed. And I think that's incredibly important, even as we move forward.
You mentioned doulas, Ms. Seville. And, I think more broadly, the idea of doulas as well as midwifery has moved from, rural Black America and, the activist Black subculture that I grew up in during the 1970s and 80s to mainstream. Talk to us about, for the people in the back who are not familiar with doulas and the roles that they play in trying to work to ensure healthy birth outcomes for Black women.
I think that goes back to some of the issues we already pointed out that drive or could potentially impact healthy outcomes. Having access to doulas or birth attendants, granny midwives, as they were known in the South for a very, very long time, or just that person that you knew in your community when someone was ready to give birth. That's who you would go to. For my family, it was my grandmother. Now it's me. A lot of times that is called in to, stand in the breach and help advocate and support moms as they birth. It's interesting to see us now at this point, bringing it back to the forefront as this really viable resource that's connected with just fantastic outcomes for mom, baby, and the community. For a while, having access to doulas and even certain types of midwives, professional midwives, it was frowned upon, right? There was this whole campaign to kind of invalidate some of the practices that were happening, and then eventually to professionalize what had become known as like this folk wisdom and this folk medicine. We had to mainstream in order for it to be validated. And I think that's kind of what we're going through right now, all of these doula certifications, which are necessary, right? And they help to drive those quality outcomes. But ultimately, it is really relying on that community-based solution, community-based support to get you to the outcome that is desired by everyone that's involved. So it's fantastic to see here for DC Medicaid, especially, that they are covering access to doula services. Moms can have access to prenatal support as well as labor and delivery support and postpartum care support through doulas. And there is a fantastic, access and just a number of women as well as a few men that are showing up in this space as doulas and offering fantastic support services.
Yeah, I was about to ask, how does one find a doula?
So you can either search online. You can also do a search through the Medicaid portal here for DC because they are registered providers now. But when you go to different, websites like Black Women's Health Imperative, Black Mamas Matter Alliance, even Mama Toto Village, very, very notable maternal home visiting program here in the district. But you can just simply Google doulas in Washington, D.C., and it'll bring up just a plethora of options. And then you'll probably have to do a little legwork to figure out which one is the best fit for you. Make sure that they accept your coverage.
And that is DOULA for our listeners,
Right.
DOULA. I do want to talk about some of the postpartum issues, Dr. Gray, and because there is so much information that has come out over the last couple of generations about postpartum. There, in some places, I'm sure there's a school of thought in some Black communities where you have a baby, you stay at home for a little while, then you just get up and you just keep it moving, and then but then as we have learned more about it, the more we know, the more complex this issue is. And so, as I told you, I was going to get into your business. So as the father of four, can you share with us any issues that your wife had during postpartum during any of those births? And what were they? How were they handled, or were they just perfect?
No, it wasn't perfect. I'll say, we have four kids ranging in age. Our youngest is 3, our oldest is 10. And with our firstborn, who's now 10, baby girl, she was born in kind of a traditional setting, I would say, traditional by American standards, in the hospital. Mm-hmm. And at the time, we were living in the Midwest. And it was a rather traumatic birthing experience. And fortunately, she had a kind of healthy or positive kind of recovery and postpartum period, but the actual birthing process was traumatic. And my wife came out of that experience saying that she knows it can be better. Now, I want to be very clear. I am a proponent of healthcare in the hospital. I'm a proponent of obstetricians, gynecologists. I have friends and family who are in the profession. However, I will say that, based on my wife's experience, my role as her husband, I took my physician hat off and was to be her husband and someone listening and supporting her and our new child, would say, how can we create a better environment and experience for them? And as we were, blessed to, within the next 2 years, find out that we were going to have another child, my wife said she wanted something different, something outside of the hospital at the time. And we were blessed and fortunate in that my wife wasn't high risk, in that she didn't have conditions like, preeclampsia going into her prior pregnancy. She didn't have hypertension or high blood pressure, as it's also called. And so, she wanted to pursue something that we could do outside of that hospital setting. And so, like Jasmine spoke to previously, and you asked about, Harold, we used a midwife for the next 3 children that we had. And we were actually fortunate to those kids. We had uneventful, beautiful birthing experiences in our home with the midwife. And like Jasmine mentioned, being able to have support around you, whether it looks like a doula, whether it looks like a midwife, whether it looks like another trained professional who can partner with the mom in ways that are meaningful, not only for the birthing experience, but also, Harold, to the point that you brought up, that postpartum period is incredibly important. Allowing moms to have that time to rest and to recover before, like you said, many just hop to the feet, get back to it. And, I do recognize that having the time to rest, having the time to recover is a privilege, because unfortunately what society tells us and what some circumstances necessitate is that our moms, our women jump back on the feet and get right back to it. And so it's incredibly important that we surround our moms, our women, with the supports they need, whether it's on the behavioral health side, navigating what may become a postpartum depression period, whether it's just the recovery, whether it's a vaginal birth or a C-section, moms need support and recovery through those periods. And so ensuring that whatever she needs, whatever the mom needs, that we are there to support her with those things.
Well, and I guess the thing that I am, particularly interested in is, yes, the physiological recovery is one thing,
Mm-hmm.
certainly. But when I think about the conversations around behavioral health and postpartum depression, for example, that can be much, much more, complex. Did you and your wife have any experiences regarding that?
Well, I'll say we were fortunate in that my wife did not have postpartum depression, but she certainly had a lot of kind of stress, I would say, whether it be from the first one or our fourth one. The stress that comes from, being the primary caretaker. And caretaker, what I mean by that is the one who is breastfeeding, the one who is, there when the baby wants to be held by mom, chest to chest. I did my best to try to hold chest to chest, but it hit different.
I guess it's not quite the same.
It's not quite the same. And so that's a large responsibility to bear, and it can be stressful. It can be very sleepless. And so that's a difficult time to navigate for our moms. And albeit my wife did not have postpartum depression, she needed that support. Now, we all, I would guess, Jasmine, you, Harold, myself, we all know women who have navigated that postpartum depression. And to your point, it is very imperative that they identify and are provided with a professional who can navigate them through their behavioral health needs during that time. And we gotta kind of demystify, debunk any kind of stigma that's associated with needing professional psychologists or psychiatric or healthcare help during that period. We have to, and it needs to be trusted messengers like you, Harold, to continue to bring this to the fore for people to be aware of. They do have choice. There are opportunities to engage professionals in your maternal health journey.
So Jasmine, please, I'm interested in your your perspective and your experience, and because this is what I'm thinking, that we see in the public square, in public conversations. A friend of mine, a guest who's been on the show many times, although I've never asked her about this, Charlotte Avery, you may be familiar with her. Charlotte and her husband, they have 7 children. And I know, a Black
God
woman.
bless them. God bless them.
I know. Jasmine, the look on Jasmine's face was just, wow. But, and in speaking to Charlotte, I've asked her on this program, are you done? And she said, if my husband said he would want an 8th child, I would just jump right in and I would do it. And so it would have. So I'm thinking, if you wouldn't want, and I'm not a mother, obviously. I have a daughter, but I'm not a mother. I have not given birth. But I'm thinking, if you've enjoyed pregnancy, and there are a lot of women who say they've enjoyed the process, of having a child grow inside, and all of the wonderful things that come with that. But I would imagine, if it didn't feel good afterwards, that you wouldn't want to do it again. That's man brain logic. I would have, and like I said, I don't know. But if a woman has a baby and it was unpleasant the first time, whether it was emotionally unpleasant, physically unpleasant, and we know all the hollering and screaming that goes on, I was there. I know. But it's like, I would imagine, I want to do that again. So help me with that, Jasmine, if you will, for those women who may have experienced postpartum depression. How do you balance that with the possibility of wanting to have another child?
That's a really layered question. I think when it comes to issues around mental health crises, especially after birth, you address the presenting problem, right? As a nurse, as a healthcare professional, Dr. Gray, what is the presenting issue? What is the presenting problem? I think once that has been addressed, potentially resolved if it was acute, or well managed if it's chronic and a long-lasting diagnosis, then we can continue the conversation around what it looks like to explore expanding your family. What I will say is that the conversation around reproductive health, maternal health, mental health should not stop just because you had a bad experience, if that makes sense. Just because you had this bad experience, it was a tough, you had a tough go of it. Maybe the birth or the delivery was not what you expected, or even just the recovery period was, more tumultuous than anyone could have anticipated. And now you're dealing with these emotional imbalances, whether hormonal or something more organic, in the sense like I had some pre-existing issues or symptoms, and now they're coming to bear, after I've had my child. It shouldn't stop the conversation around reproductive health. I think a lot of times you're still really, if you're not plugged in, as Dr. Gray had mentioned earlier, if you're not plugged in with your provider, the potential for you to still have another unplanned pregnancy is there. Right? You have to show up in those spaces to have those conversations. If you find it difficult for yourself, either come with your partner or a trusted family member or friend to kind of facilitate that discussion around what's next. Because just because you're thinking to yourself, either you're not sure if you want to have another one, you are still in the space where this could potentially happen, regardless of how you feel about it. And if you would like to expand your family, even after an episode of postpartum depression, now we have something to consider in a broader context. Now I have to understand this came up after this last delivery. How do I prepare myself to be healthy during this pregnancy, the next pregnancy? have a great outcome, and be prepared to address potential postpartum depression rearing its head again. Does that make sense?
Yeah, Dr. Gray?
Yeah, I think Jasmine, again, so eloquently stated the state of affairs in that having an unpleasant experience, as you said, Harold, whether it be physically, emotionally, does not have to be the case. I think making sure that women have those supports, such as a mental health support as they navigate the birthing experience, postpartum experience. And I think experience, whether it be from the first delivery, can help to identify those opportunities to improve for the future. So as Jasmine stated, if a woman has a unpleasant birthing experience or experiences postpartum depression during her first, that doesn't necessarily mean that she's going to have postpartum depression for the second. However, as Jasmine stated, identifying those resources so that she can enter that pregnancy, that birthing experience and postpartum period prepared is incredibly important to improving the experience that she has in a subsequent pregnancy and delivery.
Jasmine, I will let you have kind of the last word on where do we go from here when it comes to Black maternal health, how to make it better, the outcomes better, safer. What can Black women do to make sure that their situation is the best that it can possibly be?
I think that we have to just take time to educate ourselves. We have to enter the spaces and the places to engage in care. We have to amplify our voices, like Black Maternal Health Week, amplify our voices, practice that advocacy so that we can feel safe in our healthcare spaces and that we can feel heard so that we can have the best outcomes that we deserve. I also really feel like care needs to be more integrated. We need to expand that integration, not just the clinical supports, but the community supports. We have to make sure that our approaches to community-based solutions remain data-informed and data-driven. So gathering that information, listening to the stakeholders, whether it be patients, community members, prior generations, the next generations, healthcare professionals, and just really listen to what they're saying about what's going on in care. What are some concerning trends? What are some hopeful trends that we can scale up to impact things for the better? I really think that's just where we are right now.
I want to thank both of you for joining this really important conversation because Black maternal health, while being recognized this week, it is something that must be considered every single day, as we know, for our community. Jasmine Seville and Dr. Darrell Gray II, thank you both so much. I really appreciate your time.
Thank you for having us.
Sure
Thank
thing.
you.
That is the Daily Drum for this Wednesday, April 16th. I'm Harold Fisher. Good night.